The COVID-19 pandemic has triggered not just a worldwide health crisis, but also a global human rights crisis. As diplomats from around the world meet for the World Health Assembly this week in Geneva to discuss how to shape global responses to any future pandemic, they should begin with a clear look at the human rights violations that have characterized this one. At Human Rights Watch, our research teams have documented authoritarian power grabs under the guise of COVID emergency response, staggering setbacks for women's participation in the workforce, and over 1 billion children shut out of school. Over 5 million people have died and the pandemic isn't over. And through it all, marginalised communities, Indigenous peoples, and those living in poverty have borne the heaviest burden, like abusive policing, rising unemployment, food insecurity, barriers to healthcare. Many of the world's poorest communities are being left behind as COVID vaccines ease the pandemic elsewhere. We've seen efforts to secure a waiver of intellectual property rights for COVID-19 vaccines stalled by wealthy governments and their allies, thus contributing to inequity in access to life-saving health products. Any discussion on future pandemics has to include how we do this better and don't repeat mistakes. The bottom line is that diplomats should centre human rights considerations and civil society in perspectives in their efforts going forward.